Coronavirus has unleashed havoc and tragedy across the globe. More than 1 million cases till yesterday. Today is Sunday, 5th April. And the cases in India have reached over 3,000 already. And it's in that phase where it is reaching or starting to reach community transmission. And that is the number one fear of authorities and people at large today, right? So what is the objective of this video today? The objective of the video is that there are many steps taken by so many people, right, from social distancing to newfound sanitation awareness, but it is yet not helping to the extent we hoped. So we'll look at one more tool that can help us to deal with this situation, and also at the same time unburden the healthcare system at large. Viral infections. What are viral infections? We've got common cold, flu, and many other diseases which are more serious than common cold and flu. But the common factor, this is Medline Plus, US National Library Medicine summary of viral infections. The takeaway point from the summary is that when you get a virus, you may not always get sick. Your immune system may be able to fight it off. For most viral infections, treatment can only help symptoms while you wait for your immune system to fight off the virus. So the takeaway from this point is, my friends, that immune system plays a vital role in able to fend off or at least decrease the effects of the viral infection on your body, right? As we are all aware, we are all making collective efforts to flatten the curve, right? So that the medical system, the healthcare system is not burdened beyond a point of capacity, right? And I'm sure many of you must have come across this. We need to reduce the rate of growth of this viral infection, the number of cases that are happening. And we are taking number of steps. Some of them are sanitation practices, hand washing, disinfecting, face masks, self-isolation, social distancing, partial, and in our case, it is a complete lockdown for more than a week now. And we've got another more than a week left right now. This brings me to vitamin C and viral infections. Why vitamin C? Because this is something within our reach, my friends. Vitamin C is something which is within our reach. And it is interesting to see what it can do. So let's have a look. This is an old study by H. Clay Gorton and Kelly Jarvis. This was done in '97, and it had a number of revisions over the period, and it was made available on November 2005. I've given the link below to go through the entire study, but the conclusion drawn was vitamin C in mega doses administered before or after the appearance of cold and flu symptoms relieved and prevented the symptoms in test population compared with the control group. I want to play a small clip. This is a person that I follow. He tries to dissect a lot of scientific findings and reports and even anecdotal evidence and his own opinions into a simpler language that people can understand. And this is just a 1-minute clip. He talks about how a virus fights, how vitamin C present in your body, near your cells, can fight a virus infection, right? Here it is.
Vitamin C it encounters. And vitamin C is an interesting kind of a thing because all viruses have these little mechanisms, we can call them spirochetes, whatever, that attach and try and infiltrate in the intercellular membrane. between two cells. And then they get in there and they hijack the protease out of a cell and replicate. Well, when you got vitamin C in your body, the virus comes along like that and zap, it actually gets an electron donated to it by the vitamin C. And two major things occur. The little mechanism is fried. It's zapped with a charge it can't deal with, and it literally destroys that little virus's ability to get into any other cell, because that spirochete thing is dead with this electron donation. Plus, vitamin C, once it donates that first electron, isn't vitamin C anymore. It becomes a number of other signaling chemicals to the body, and those activate other vitamin C in that proximity to start shedding electrons like mad. So any virus around that one also gets zapped.
So I'll be sharing the link to this video soon. Now we come to COVID, not common flu, not common cold or flu, right? This is a very different beast of a virus. And the Chinese have been using IVC, which is intravenous vitamin C, in hospitals to treat COVID-19 patients. This has been done multiple times, and not just in one or two in vitro trials. This has actually been tried on patients infected with COVID-19. So in terms of drugs, the only drug with human trial today is vitamin C. Chinese editor Dr. Richard Cheng. Dr. Richard Cheng is a big advocate of vitamin C. He has conducted several trials, or rather consulted in several trials for patients of COVID-19 in China. I'm quoting him. He says, in a second clinical trial of IVC was announced in China on Feb 13th. In this study, Dr. Cheng, they plan to give 6,000 milligrams and 12,000 milligrams per day for moderate and severe cases. We are also communicating with other hospitals about starting more intravenous vitamin C clinical studies. We would like to see oral vitamin C included in these studies, as oral forms can be applied to more patients and at home. This is a point to drive with home, right? I mean, being able to administer something as simple as this at home can have tremendous help in fighting this pandemic, my friends. This is an interesting article, and I'm continuing another quote by Dr. Cheng in this article. He's a US board certified specialist in anti-aging medicines. Vitamin C also is anti-aging in nature. Vitamin C is very promising, he says, for prevention, and especially important to treat dying patients when there is no better treatment. Over 2,000 at the time of this article, over 2,000 people have died of COVID-19 outbreak, and yet I have not seen or heard large dose intravenous vitamin C, IVC, being used any of the cases. The current sole focus on vaccine and specific antiviral drugs or for epidemics is misplaced, in his opinion. He also adds early and sufficient large doses of IVC are critical. Vitamin C is not only a prototypical antioxidant, but also involved in virus killing. It is also involved in virus killing and prevention of viral replication. Very important point here. The significance of large dose IVC is not just at antiviral level, it is acute respiratory distress syndrome that kills most people from coronaviral epidemics, be it SARS, MERS, and now novel coronavirus pandemic. ARDS is a common final pathway leading to death. We therefore call for a worldwide discussion and debate on this topic, Dr. Cheng says. News of vitamin C, this article highlights that the research for COVID-19 is being actively suppressed in case of vitamin C administration. Anyone saying that vitamin therapy can stop coronavirus is already being labeled as promoting false information and promulgating fake news. Even the sharing of verifiable news and direct quotes from credentialed medical professionals is being restricted or blocked on social media. You can see the sequential examples of this phenomenon at my Facebook page, the author says, and I've given the link for this, which you can see the whole report later. There was another article highlighting a group of medical doctors, healthcare providers, and scientists met online on March 17th to discuss the use of high-dose IVC in the treatment of moderate to severe cases. Dr. Enkin Mao was in attendance. He's the chief of emergency medical department of WUHAN Hospital, a major hospital in Shanghai affiliated with Jiaotong University. Dr. Mao stated that his group tested about 50 cases, moderate to severe cases of COVID-19 infection. So this is like human trial on COVID-19 patients with high dose of IVC. Dosing of IVC ranged from 10,000 milligrams to 20,000 milligrams for 7 to 10 days, with 10,000 for moderate and 20,000 for severe cases. The first bit of good news was that all patients who received IVC improved, all of them, all 50 of them, and there was no mortality. That's great. 50 is a smaller test case, but it's the largest, probably the test case of active COVID-19 patient human trials that I have come across or anyone has come across at this point of time. Secondly, this is a very important point, as compared to the average of 30-day hospital stay for all COVID-19 patients, those patients who received high-dose intravenous vitamin C had hospital stay of about 3 to 5 days shorter than overall patients. That means 10 to 20% less time spent by a patient in hospital under this treatment for COVID-19. And that also contributes to lessening of the burden on the healthcare system. These are very important points, and for some reason we do not see as a mainstream discussion in the media at this point of time. This is an article by Andrew W. Saul of Orthomolecular Medicine News Service. There is a company called DSM which sent 50 tons of vitamin C to the hotspot of coronavirus, the epicenter province of Hubei, right? And this is the truck here. You can see this here. And in Chinese, the literal translation of this was, in fight against novel coronavirus, the people of DSM Jiangshan and Wuhan are heart to heart. 50 tons is a lot of vitamin C, my friends. A lot of vitamin C. The news media are not reporting this, is what the article says, or any other significantly positive megavitamin news. The article also highlights many different verifiable news and reports that are compiled in a certain table here, which you can click and see for yourself. I'll be sharing the link below. We see China as quite suspiciously, but what is happening in China is actual happening. It's not a propaganda from Chinese Communist Party about vitamin C. It's not. This is an article of New York hospital who are treating coronavirus patients with high dosages of vitamin C after promising results from China. This is widespread now. I mean, in terms of countries, there are 3 separate trials done in China already with very positive results. Now it is New York who is using it in critical care units. Patients, this is Dr. Andrew Weber. He says he's been immediately giving his intensive care patients 1,500 milligrams of IVC. The Long Island-based pulmonologist and critical care specialist with Northwell Health says patients are given 3 to 4 such doses a day. The article further says the doctors throughout the state, New York State, are giving their critically ill coronavirus patients massive doses of vitamin C, a tactic said to have helped those hit hardest in China. Dr. Weber, a Long Island pulmonologist, he said a very important quote, my friends. And the quote is this: The patients who received vitamin C did significantly better than those who did not get vitamin C. He further added, and this is a very important thing, it helps a tremendous amount, but it is not highlighted. It is not highlighted because it's not a sexy drug. Vitamin C supplements and vitamin C treatments are very cheap compared to other expensive drugs. And that is why perhaps there is no merit that media or the agencies find in promoting or highlighting this. In the fight to, in our collective fight to flatten the curve here, right, we have been practicing a lot of non-pharmaceutical interventions, right? Non-pharmaceutical interventions means sanitation practices, face masks, isolation, social distancing, lockdown, anything that does not involve pharmaceutical drugs. Because at this point of time, we do not have pharmaceutical drugs, right? In pharmaceutical interventions, the remedial drugs are in vitro trials. That means human trials are far, far away, right? Vaccines are at least 1.5 to 2 years away. And we don't know what kind of effectiveness will the first version have. It may even take more than that. Intravenous vitamin C is a kind of pharmaceutical intervention that doctors can use for moderate to severe cases upon hospitalization, right? It is available. Human trials have been done in China and US, and this should really attract more research from government as well as medical practitioners and researchers. But sadly, that's not been the case so far. I also would like to highlight a third way, a nutritional intervention to help unburden the healthcare system. This is in form of dietary and supplementary vitamin C. It can be self-administered at home, but these cannot be in mega doses. These should be limited in recommended dosage. That is not on vitamin C, my friends. The attention is on more expensive drugs. This is an article on that I found on Economic Times. This is a malaria drug may lead fight against COVID-19. And what does the article say? The article says that first highlights as to why this is suddenly in limelight. You remember President Trump of US, he tweeted about hydroxychloroquine. It's an anti-malarial drug. And since then, I think at least 2 people who have consumed it have died. A Chinese study also reported that hydrochloroquine can effectively inhibit SARS-CoV-2 infection in vitro. In vitro means they've done lab testing in controlled environment, not human trials. We do not know how it will react with a COVID-19 patient. These preliminary studies sparked intense interest after Trump tweeted. Before that, none. I wonder why. Suddenly after this tweet and the governments, some of the governments acknowledging this may help, a lot of pharmaceutical companies have come out saying that they have the capacity or they're trying to build capacity to manufacture hydrochloroquine. Now, what do experts say? Dr. Anthony Fauci, he is US top infectious disease expert. He's been working with the White House continuously. He has been tempering the expectations about the prospect of hydrochloroquine. He's not as confident as others. According to Fauci, it was too early to say that any anecdotal evidence still needs validation in randomized clinical trials. He's not confident on this. French Health Minister Olivier Véran said his government was against prescribing hydrochloroquine or using it for anything other than severe cases. Now, understand, you cannot take hydrochloroquine at home. It is risky to take it even under medical supervision, right? That is the state of a so-called remedial drug at this point of time. I'm going to give you a quick comparison here of hydrochloroquine and vitamin C. No human trials done on hydrochloroquine. We are still far away. Several patients in cases of vitamin C, China and New York, already treated with high dose of IVC. So we have more data in terms of vitamin C than hydrochloroquine in the case of COVID-19. Now, hydrochloroquine has been promoted by politicians and some doctors in US and France, and media has picked it up. And in case of vitamin C, which has made so much of groundbreaking result, almost complete blackout of information from officials and mainstream media. The side effects can be severe in case of HCQ hydrochloroquine, even with recommended dosage. Side effects, if any, in case of vitamin C are generally mild and mostly in cases of overdose, megadose. Prescribed only in emergency and severe cases at hospitals, hydrochloroquine. And vitamin C can be taken organically through daily supplementary tablets at home. HCQ does not have any other benefits to the body. Vitamin C has several health benefits. This one is expensive, this one is cheap. I think the last point drives home as to why so less information today is available when it comes to vitamin C treatment. Nutritional intervention is highly underrated, and media and pharma lobby wants to push these expensive, fancy drugs. And that is alarming, especially in cases of such distress. Now, vitamin C, is it possible to take too much vitamin C? There was a question asked on mayoclinic.org. A registered dietitian and a licensed dietary expert replied that vitamin C is water soluble, right? It supports normal growth and development. For adults, it is recommended between 65 to 90 milligrams with an upper limit of 2000 milligrams. But more than 2000 milligrams may lead to some effects. Although this expert says that dietary vitamin C is unlikely to be harmful. Megadoses as in the human trials in China and US, they have given 10,000 milligrams, 5,000, 15,000, 20,000 milligrams of IVC. In those cases, yes, side effects are most likely. And what are those side effects? Diarrhea, nausea, vomiting, heartburn, abdominal cramps, headache, insomnia. I believe, in my layman opinion, none of these are life-threatening. And there is no necessity for anyone to go with megadoses. It is risky to do that without proper medical supervision. But you can look at the upper limit of up to, say, 2000 milligrams a day. And that will help you in the long run. It will help you and your family in the long run. Now, can vitamin C, the big question is, can vitamin C reduce the burden on the healthcare system? Yes. The preliminary studies show that it can, but more studies are required, more attention is required to ascertain this fact. Right now, it may be estimated, but it's not clinically proven yet because there is absolutely no attention or research done on this in large scale. It needs to be done. Vitamin C, home administered with upper limits, can reduce the number of patients flowing into the hospital in the first place. And in case if somebody infected were to reach the hospital, the need for critical care services may be reduced. The chances of it may be reduced if the person has a strong immune system, right? Various studies have said that about estimated 80% of infected patients do not need hospitalization, but that 20% is still a huge burden on the hospital system, on the healthcare system, given the fact that many leaders of the nation, many experts have said that anywhere between 40 to 70% of the population would be infected by coronavirus at some point. And that's an alarming number. 20% of that would cripple beyond imagination our healthcare system. So any effort that can be deployed by us and by doctors with help of nutritional intervention to reduce the burden on the healthcare system will help us, the society as a whole, right? Another thing is, if in case there is hospitalization, the time spent by a patient in a hospital, it has been observed that under vitamin C treatment, the time spent is reduced by 10 to 20%. That means the faster turnaround time would mean the beds or the medical facilities made available to various patients uh, are vacated sooner, and it is made available to new patients who require it. This, this itself should incentivize researchers, the mainstream media, the government, and its allied and its supervised medical agencies to quickly do further research and look at deployment at various levels. Home administration is a big and cheap way to do this. The expensive drugs cost 50 to 100 times or even more than that compared to vitamin C supplements. Can we not distribute these supplements to the poor and ensure that the burden on the healthcare system is reduced by lesser requirement of hospital admittance, right? I strongly urge all of you who are watching this to spread this message. Spread this message to your friends, your family, your distant relatives, anyone in your community circle, so that the simple tool can be used safely and the chances of this tragedy inflicting more havoc and pain on us can probably collectively somewhere reduced. I have got my vitamin C. I hope you get yours too soon. Okay, great. So this is where I think the government and media should actually proactively try to educate people on the possible side effects, the possible dosage, the space between two dosage. For example, if you have too much of vitamin C at once, your body cannot absorb all of it at once. So it will be wasted in urine, it will be passed along. You may have some side effects too. So what is important that is that you space it during the day. 2 hours, 3 hours, 4 hours, give time for one dose to be absorbed properly, right? Yes, you can have, say, for example, about up to 100 grams, smokers maybe 20, 30 grams more, but during 20 milligrams more, not grams. Smokers may be more, but during times of pandemics, right? I mean, this is an extraordinary situation. I mean, why would you want to shut your business? Why would you want to work from home? Why would you want to not go out or socialize? You are, this is, there is social, economical side effect already. So, if the government is afraid that somebody might get nausea once in a while or say diarrhea once in a while because they accidentally took a lot more vitamin C dosage than recommended, I think that falls far shorter a risk than two people after listening to Trump taking hydrochloroquine and dying, right? And governments can give more such awareness. Like, for example, the upper limit, which many articles and registered dietitians and registered licensed dietitians recommend, is roughly about 2000 milligrams. So you can up your dosage. Your normal food may not give you 2000 milligrams a day, so you may have to take more vitamins, supplements, right, to assist you in that. So if you speak to your doctor, he may be able to prescribe in case prescription is needed for it for higher dosage. But I think this can be explored safely. yes, I also wanted to highlight this part that the kind of vitamin C that you take, the delivery method, there are three major delivery methods, right? One is your ascorbates or ascorbic acid. These are very inexpensive supplement pills that you get. Some of them are chewable. Um, and if you take, say, 100 milligram dosage, your body will absorb only 20 milligrams. 20% is the absorption rate. If you take an IV, which many doctors give mega doses during critical care in hospitals, that has 70% absorption rate, right? And there are more expensive form of tablets called liposomal vitamin C, which has 80% absorption rate, but they are less available and they are very expensive as well. So government or doctors need to also clarify when they say that upper limit is 2000 milligrams or say normal recommended is 500 milligrams per day per person. Is it including the absorption, considering the absorption rate of 20% in most cases? So there are a lot of unanswered questions, and it would do the world a lot good if these questions are answered.